Good evening, folks. I have discussion E for you. Now we're gonna be discussing President Trump's uh, initiative for Rural Health Fund. Um, okay, so here we go with discussion E for the night. The Trump administration has formally launched the 50 billion Rural Health Fund, a sweeping initiative created through the One Beautiful Bill Act. The program, known as the Rural Health Transformation Program, is designed to channel significant resources into rural health systems starting next year. All 50 states applied to participate, signaling the scale of interest and the urgency of rural health challenges. Funding breakdown. Total size 50 billion. Distribution 50% equally across all states, ensuring every state receives a baseline level of support. 50% performance based, divided according to 50% ruralness. How much of the state's population lives in rural areas? 20% state policies, commitments to reform and expand access. 30% improvement plans, specific strategies for strengthening rural health infrastructure. The dual structure reflects an attempt to balance uh, equity with incentives for innovation and accountability. Timeline and amounts. Start date: funding begins next year. State awards. Average of 200 million per state, ranging between 145 million and 281 million. Application review conducted over 6 weeks with emphasis on policy commitments and measurable outcomes. Conditions and reinforcement. The program includes clawback provisions. If states fail to follow through on promised policy actions, the federal government can reclaim funds. This mechanism is intended to prevent states from making empty commitments and, and to ensure accountability in how taxpayer dollars are spent. Criticism and concerns. Despite the promise of new funding, critics highlight that the legislation also enacted sweeping Medicaid cuts. Analysts warn these reductions could undermine the very rural communities the fund aims to support. The health policy nonprofit KFF projects Medicaid spending in rural areas could decline by 137 billion over the coming years. Critics argue that while the fund provides short-term injections of cash, the structural weakening of Medicaid may erode long-term access to care, particularly for low-income and elderly populations. This tension raises questions about whether the Rural Health Fund will offset or merely mask deeper systematic losses. What to watch next? Improvement plans, how states design and publish their strategies can, and whether they prioritize workforce expansion, telehealth, or infrastructure updates. Clawback reinforcement, whether the federal government actively reclaims funds from states that fail to meet commitments. Medicaid impact. Independent analysis will be crucial to track whether the net effect of the legislation is positive or negative for rural health access. Equity outcomes, whether smaller, more rural states benefit proportionally compared to larger states with mixed urban rural populations. Broader contexts. This rollout underscores the paradox of rural health policy in large scale. Funding initiatives often collide with structural reforms that reduce safety net programs. The Rural Health Fund could bring new clinics, telemedicine networks, and reinforce incentives to underserved areas. Yet, if Medicaid cuts hollow out coverage, rural hospitals may still face closure and patients may struggle to afford care. In essence, the program represents both historic investment and a high stakes experiment in balancing fiscal policy, healthcare equity, and political priorities. the coming years will reveal whether the 50 billion fund transforms rural health or becomes overshadowed by Medicaid reductions embedded in the same legislation. Okay, guys, that's it for tonight. I will see everybody tomorrow for shows. Until then, Gator Wellness, have a good evening, folks.